So, my name is Vasa Turchin. I'm a professor of health informatics at King's College London in the School of Life Course and Population Sciences. And my research area is in application of informatics technologies to medical problems. Data is at the core of healthcare. If you look at it historically, medicine started when we started collecting data, when people started sharing experiences, saying, oh, this plant put on this wound will actually help. When that experience started being shared, and that was the first instance of using data and evidence in medicine. So, use of data in medicine is nothing new. But what did change is that we are capturing more and more data. And we are finding ways of using this vast amount of data that we are collecting to come up with different treatments, better improvements, and to manage that at scale. So data-driven health really is application of all these technologies and all these methods that we've accumulated over the centuries with the technology and with the platforms that we have right now, enabling us to deliver these solutions at an unprecedented scale. If you look at the UK and the health situation in the UK, there is very much a need for health data scientists. So from the population health standpoint, using these technologies enable us to reduce inequalities and to ensure consistent provision of care across the different social, economic, ethnical groupings in whichever country around the world we want to look at. There are several problems that the UK is facing with regards to health, and one of the main ones is the aging population. So, aging population typically has more complex healthcare needs. And these need to be delivered to an increasingly larger number of people. Forecast is that we're going to have 24% of our population over 65 by 2043. So, the needs will be rising. And there is this assumption that we will be using the health data science, and artificial intelligence to enable this step change that is needed. Now, I'm also one of the two directors of the DRIVE-Health Centre for Doctoral Training in Data-Driven Health. Now, in the UK, the funding for PhD studies is organized through these large centres that host cohorts of students, which then work together. They benefit from peer-to-peer learning, mutual support, shared training, and generally exploiting the economy of scales. So King's funded one such Centre for Doctoral Training 4 years ago as a small seed-funded pilot, which we then expanded, bringing in additional funding to deliver 30 PhD studentships in that first iteration of DRIVE-Health. And then this year, UK's Engineering and Physical Sciences Research Council, EPSRC, awarded us further £8 million to deliver 85 studentships over the next 5 cohorts. Aging population has more complex healthcare needs. And in order to meet these needs, we need to make best use of the electronic health record data that we are collecting that enables us to do personalized healthcare. It requires us to make better use of the AI technologies that are emerging now. But AI, you can't just sprinkle AI fairy pixie dust onto the NHS. It is a broader picture. And what DRIVE-Health does is it provides training across the whole landscape, from the research innovations to actual improvements to the health system and patient care. So our research themes span broadly data and design, with the data themes looking at the ways in which we integrate, analyze, and model the data, and design looking into how do we translate the findings of these themes into impactful real-world solutions. So on the data side, we have the sustainable health engineering for health systems, where we explore technologies for building scalable solutions that work across different domains and develop search engines, develop particular infrastructures for deploying models into the open. We have a theme around multimodal data streams, where we look into how to integrate data from different sources, devices, at different level of detail, at different scale, and how we put them together so that it can be analyzed and exploited. And we have a theme around building simulations, using digital twins, where we build digital models of real-world patients or real-world communities, so that we can evaluate the applications of AI technologies, for example, on simulated communities or a simulated patient rather than on real people. On the design side, we want to ensure that we build tools that are used and can be used in clinical settings or with real patients. And one core element of that is building interfaces that are approachable and amenable to our users, whether these are clinicians in the emergency ward who need to quickly scan through the recommendations they're being given for a particular patient, whether they're GPs who have 10 minutes to consult with a patient and we need to understand how their focus is changing as we're giving them advice, when should a certain advice be given, whether these are patients who may be suffering from consequences of stroke and have different abilities into how they can use the mobile apps. So all these technologies, they come under our fourth theme. And our final theme is around, it's an overarching theme, particularly when it comes to training. All of our students need to take training in this. It is around co-production and co-design with the patients. So how do you ensure that patients are being consulted throughout the process, that they're an active participant not just in the use and in their healthcare, but in the design of these systems? How do you build tools in such a way that you get meaningful input from the stakeholders involved, patients, clinicians, or other actors in the process, if need be? It aligns with the push for the AI and health data science, which is present across different sectors. And also the growing awareness that UK has a tremendous potential in the health data that it has, simply because of the way that our health system is organized. We have a single health system. We have the NHS, and we have the data within the NHS. People look up to the data that we have and the health data opportunities that are present in the UK. So truly, I think that the UK is one of the best places in the world to be doing this type of research. So our electronic health records are largely structured. So we have coded information stored in particular fields. So we have a specific code for a specific disease, or a code for a test that we've done, or a code for an observation that we made from the patient. But we also have the unstructured element to it, so free text notes. And in some disciplines, they're utilized more than in some others. For example, you will sometimes have in mental health, for example, quite often the doctor will feel that they can better express their thoughts and reasoning through a narrative rather than just entering a series of codes. So what we need is complementary approaches that use both structured data and unstructured data as well. We're operating across several research areas. We're not restricted to a single question, a single field. And we're doing something that is of broad importance, that will have a massive impact on the quality of life of people, on our health provision in UK and internationally. are planning right now 85 PhD projects over the next 5 recruitment cohorts. And now with every cohort lasting 3.5 years, the final one starting in 2029, we expect that in some shape or form we will exist until 2033. So it's a 9-year commitment for us.